Okay, so what are the biggest challenges that you had in those first few weeks of having twins?
So one of the biggest differences for moms to keep in mind is when you have twins, it's usually by cesarean. Not always, but it's scheduled, it's planned, there's a certain time frame that they want you to deliver by. So for us, we had the babies and they were whisked away to the intensive care just because they were so small, so young. They were 32 weeks and I had to stay behind. So when I was finally able to go see them, that's for the first time, it's kind of a shock. So if you're having twins, just remember 2 babies are going to be half the size of a normal baby because they're taking up the same volume in your stomach. So they were quite tiny. They had lots of different tubes and monitors on them. So it wasn't the same as when I had my daughter initially, where I just had her naturally and vaginally and she was put right on my chest and we were ready to go. So just being prepared to kind of take that step back and realize that they are in good hands, but it's not going to be the same as what you have done before maybe, or maybe what you've kind of pictured in your head of having your baby and holding them right away. Like I had mentioned before, if possible, stay in the hospital as long as you can after you have twins. They will let you stay usually for an extra day or so. Just spend that time being with the 2 babies, getting to know both of them. The other thing I recommend too is they should have a lactation consultant from the hospital come and visit you before you leave. When I was there with the twins, I had already nursed one baby, but they did come in. They help you get set up with a breast pump, which you can then take home. They make sure that everything is fitting properly, because if you've never used one before, there's different size phalanges, the actual covers that go over your nipple. There's lots of moving parts. They teach you how to clean it if you need that information. So it's nice to definitely meet with a lactation consultant before you go. And while you're in the hospital, you can actually go and nurse your babies. You can pump for them in your room or while you're visiting with them in the NICU. So you do still have that bonding experience. It's just not going to be exactly like you would imagine in most cases.
And so kind of going off that with breastfeeding, so you kind of talked about breastfeeding, especially being how small they were, like it's just a whole different like game, and so what would you say for like tips for breastfeeding premature babies, and kind of how did you do that as well? I know it's a little different.
So before we left the hospital, they of course try to get you to nurse, and right away it was evident that their mouths were teeny tiny. I'm talking like, the tip of a pencil, an eraser. So they have special things called nipple shields. That's basically a piece of clear plastic that you can put on your breast that tries to like pinpoint where the milk would go. But not all babies take to it. Newborn babies are not often as strong, so they don't always have that force of suction because their muscles are still developing, just like their eyes and other parts of their body. So they can't always nurse. So what we ended up having to do, which was great, it worked for us, was I would pump and then they would introduce that into a teeny tiny miniature bottle with a very, very slow flow nipple so that they could still get the breast milk. If for some reason that doesn't work, you can still pump and they can take the breast milk and do an NG tube where they just put a little tube down the baby's nose and it goes down into their stomach, and then they can still get your breast milk that way. So there's lots of options, and of course the staff will be able to help you navigate what works best with your body and your baby's body, because you are at the beginning learning how they kind of pair and mesh together. So being open-minded, I think, was key. I had in my head that I was nursing these babies and it was twins and I would have one on one side and one on the other and be ready. And then right away it was evident that that was never going to happen, but we make it work.